In the last 5 years, we've seen a tremendous increase in the number of cosmetic procedures performed on men. There's been at least a 43% overall increase in male cosmetic surgery. Many of the operations we perform are similar to women, but have to be done differently. One of these is the brow lift. We perform facelifts on women and men, brow lifts on both, but we have to take into consideration the differences between the two. In a male brow lift, we don't want to create a feminine appearance. The women would prefer to have more of an arched brow, whereas men commonly have more of a straight brow. And it's very important to make sure you take this into consideration when performing the operation. The operation can be performed different ways. The most tried and true and operation that's been around the longest is the so-called coronal brow lift. In the coronal brow lift, we make an incision from one side of the head to the other across the top. We loosen up the tissue of the forehead, the scalp of the forehead down to the eyes. We pull it back, we remove a strip of that scalp and sew it up. And this lifts up the forehead. But unfortunately, it also has a tendency to pull the hairline back, which is not a good thing for a man. The other problem with the operation is that it leaves a scar across the top of the head, which may be visible someday if male pattern baldness develops. Consequently, the most commonly performed operation for men for a brow lift is the so-called endoscopic brow lift. With an endoscopic brow lift, we make small incisions, we put a scope underneath the tissue, we can see what we're doing with the scope. There is no need for a big long incision. We can loosen up the forehead, pull it back, and fixate it in its new position and create a nice lift to the brows without the scar of the so-called coronal brow lift. Other ways of doing the operation for a man would be to do the so-called direct brow lift. In that operation, we would make an incision just above the eyebrow in the natural boundary to try to hide the scar, remove a strip of skin above the brow, and lift it up. Another way, not commonly done, however, would be to make the incision along a natural crease in the forehead, thereby hiding that and lifting up the forehead and removing a strip there. Once again, the most commonly performed procedure in men is the endoscopic brow lift.